So my presentation is about art therapy, and I'd like to just start with a definition. So what is art therapy? The National Health Service of the United Kingdom defines art therapy as a form of psychotherapy that uses art media as its main mode of expression and communication. Art therapists and art psychotherapists use art as a medium to address emotional issues which may be confusing and distressing. And that's a lot to take in. So I'd like to break that down a little bit. So psychotherapy is just a form of therapy that focuses on mental health. Art media is any form of art the therapist and client are comfortable with. And this can range from more traditional forms of art media like painting and drawing, all the way across the spectrum to dancing, sculpture, collages, photography, whatnot. And a medium is just a means of doing or addressing something. So altogether, an art therapist uses a wide variety of art forms to unravel emotional difficulties with the goal of resolving or alleviating mental health issues. So where did art therapy get started? So a key point to remember is that art has always been therapeutic for humanity from our earliest beginnings and all throughout history. And I've just gathered some examples here. So, for example, even cave drawings from our ancient ancestors show that art has always been close to the human spirit. This is a very famous piece of art by Frida Kahlo. It's called the Henry Ford Hospital, and it shows her just after having a miscarriage. This is Edvard Munch's The Scream, and this is a portrait of Vincent van Gogh. And you know, all three of these pieces, while they are somewhat contemporary, they really show this message that art can be a form of therapy. It is almost always for artists a way for them to work through their feelings or any traumas that they may be experiencing. But art therapy in its modern context gets its start from Margaret Naumburg here in the United States, and she's really considered the mother of modern art therapy. So she was born in 1890, and she spent a lot of time working in schools where she believed that art was really good for everyone. So to that end, she would encourage both her students and staff alike to express themselves through art, which generally had very positive outcomes for them. But then once she got started on developing art therapy as its own discipline, she used the basis of Freudian psychoanalysis, which is really sort of beyond the scope of this presentation. But what that means is just that she believed that art could be used to access feelings and emotions that are buried deep within someone's unconscious mind, and really help bring those to the forefront so that people can work through those in a more conscious way. And so, through developing this technique, she established art therapy programs across the United States. She gave lectures across the country. She helped develop college programs across the country. And she actually introduced an undergrad art therapy program at New York University, which today remains one of their most accredited undergrad programs. So, while contemporary art therapy um, doesn't really have that Freudian basis anymore, it still serves that same purpose of helping their clients process unpleasant emotions, gain self-confidence, and just generally express themselves. So, what does art therapy look like? In generally, a session of art therapy will have four rough steps. The first one is the check-in, which is just a opening discussion between the patient and the therapist, just um, a catching up and a exchange of expectations for both the session and the long term, and so on. Then is the main body of the session, which is the art making itself, obviously. And there's a lot of variety to explore here. So these sessions can be guided or unguided, so the patient might have free reign or might be given a prompt by the therapist. Um, They might be in silence or they might hold a conversation. It really just depends on the patient-therapist dynamic. Then following that, there's a discussion. And the key takeaway here is that the art needs to be discussed from the client's perspective. We don't want the therapist to put forward their own opinions here, because a lot of the therapeutic aspects of the art come from the artist's own interpretations. And then finally, there's a checkout, which is really just a review and then a transition from the session back to everyday life. So who benefits from art therapy? Uh, there is a common misconception that only children really benefit from art therapy, but this is just untrue. So anyone with excessive stress, anxiety, or depression will benefit from art therapy. The very young, the very old, and others who have difficulty communicating emotionally, as in uh, linguistically expressing their emotions, will benefit from art therapy. Those with eating disorders and other difficulties with perception and self-image will benefit from art therapy, which should be sort of self-explanatory. It is a very visual medium. Those dealing with social and familial issues will benefit from art therapy. And those with severe mental and neurological disorders, including schizophrenia and dementia, will also benefit from art therapy. So, really, everybody benefits from participating in art therapy. Now, what does art therapy do? What are some potential outcomes that we'll see here? So in general, art therapy reduces stress and anxiety, and it does this two ways. The first is reducing cortisol levels. Cortisol is it's a stress hormone, and is known for introducing the fight or flight response in a person's body, which in general increases anxiety. So, uh, um, art can help reduce cortisol levels. It can also increase dopamine release, which is almost the opposite of cortisol. It's a brain chemical responsible for feelings of happiness and relaxation. And then art therapy can also help inspire confidence and self-esteem in one's own abilities. It can spark creativity, and studies have shown that it can encourage a will to continue to make art. And it also just shows in studies positive outcomes for people with mental disorders, and in particular, depressive disorders and anxiety, cognitive impairment and dementias, Alzheimer's disease, schizophrenia, and autism. So in general, art in all of its forms benefit everybody, and art therapy is no exception. So thank you for watching.